just leading on to that question, what other solutions could we provide from an engagement perspective in regards to epidemic preparedness and response?
Well, let's see. That's a big one. I mean, I think if you're talking about preparedness and not engagement at the time of an outbreak, which is important because you don't build trust in times of crisis. So I think really if you think of engagement as trust building, I think mapping, who are the people and the institutions, the stakeholders in a community that would be the people you'd want to call on or that would play a role in an epidemic or pandemic response. They should know, communities should know or think that through before they're actually struck by some kind of epidemic. Ways to engage is like thinking that through in advance. I know there was a lot of talk about that after a few, SARS, avian flu, Ebola. A lot of communities have faced threats, and I think in retrospect and in future, looking forward prospectively, trying to think through, well, what would we do? What would be our instinctive things we do? Who in the community should we call on? What roles should we play? I think to involve in the planning if it's a preparedness thing.
Yeah. So I guess leading on from this question is, do you feel that those involved in immunisation delivery and research are by and large trusted by the communities that they work in?
Depends on the community. But I would say that in general, or by and large, as you say, the health workers and health professionals still manage to stay at the top of the who do you trust list. While government, media, certainly industry have dropped down the list in terms of trust with the public, the health profession still has stayed ahead above the others. Now, it's a fragile lead, so I think it's really important that keeps being renewed, and we can't take that for granted. But yes, by and large they're trusted, but again, it depends on the community, it depends on the local experiences.
Mm.